Hi everyone, I am Dr. Anthony Dakpallah, but you can call me Tony. Today we are talking about something that can sound scary but really needs to be understood clearly, and that is ectopic pregnancy. This is one of the most important conditions we look for during your first trimester scan, and detecting it early can literally save your life. So, in this episode, I'll explain what an ectopic pregnancy is, why it happens, what symptoms to look out for, how it is diagnosed, and what you, as a patient, should do if this ever happens. In a normal pregnancy, the fertilized egg travels from the fallopian tube into the uterus, where it implants and it starts to grow. But in ectopic pregnancy, that egg implants outside the uterus, most commonly inside the fallopian tube, though it can rarely attach to the ovary, it can also attach to the cervix, or it can find itself in the abdominal cavity. The problem is these places cannot support a growing baby. As the pregnancy grows, it can cause internal bleeding, which can become life threatening if not detected early. That's why early ultrasound is so important. It helps us catch it before it becomes dangerous. An ectopic pregnancy can happen to anyone. However, certain factors may increase the risk. For example, a previous ectopic pregnancy. So, if you've ever had an ectopic pregnancy before, you have a higher chance of getting it again. Also, pelvic infections like untreated STD, sexually transmitted diseases, can cause it. Tubal surgeries can also cause it, or the use of certain fertility treatments. However, in many women, there is no obvious cause. So don't blame yourself if it happens. It's not your fault. Early on, an ectopic pregnancy can look just like a normal one. You might feel mild cramps or breast tenderness, but as it develops, warning signs may include lower abdominal pain, usually on one side, either your left side or your right side. You may have vaginal bleeding or spotting. You could have shoulder pain if there is internal bleeding, and this is what we refer to as referred pain. Or you could feel dizzy or faint, especially if it's in an advanced stage where you've probably lost um, quite a significant amount of blood. If you experience any of these changes, especially with a positive pregnancy test, please do not ignore them. Go to a hospital immediately and ask for an ultrasound. How is this diagnosed? How is an ectopic pregnancy diagnosed? The diagnosis is made through a combination of ultrasound and blood tests. So during the scans, the radiologist will look for whether there is a gestational sac inside the uterus, or and we will also look for any mass near the fallopian tube. And sometimes we may look for free fluid in the abdomen, which may suggest that there is a bleed or that there is a leaking ectopic or a ruptured ectopic. If the uterus is empty but the pregnancy test is positive, we will look carefully around the tubes and the ovary, and that's often where we find the ectopic pregnancy. There are instances where you may test positive for a pregnancy, and then the uterus in your first scan may be empty. And at the same time, we may not find a gestational sac outside. In such instances, we may ask you to, we may observe you closely, and because sometimes the patient might come in at a very early stage where we cannot detect um, the sac, the gestational sac, and so and and so it's best that we ask you to come back and then we do a scan maybe after a few days or weeks. So what happens next if an ectopic pregnancy or gestation is found out? Your doctor will decide on the best treatment depending on how early it is caught and your symptoms. There are usually three options. We can do medication where we give some medications such as methotrexate, or if it's caught, and these medications are usually given when it's caught early enough, and so it's very small. So this can actually cause it to resolve or shrink. Also, then the next thing we can do is that we may have to do a surgery, which we do most of the time. Surgery a lot of the time is the preferred way to go, especially if there is heavy bleeding or a rupture. So we go in there and we take out the ectopic tissue or the ectopic pregnancy. And also, this enables us to stop bleeding inside, internal bleeding, especially if there's a rupture. And this is usually done through a small incision, which during a laparoscopic surgery. In some instances, the incision may be a little bit larger, depending on how bad the situation is. We may also observe in very early or uncertain cases, we may watch closely with repeated scans and tests to see how things will progress. However, this method is not something that is widely used. But whatever the method, the goal is always to protect your health and future fertility. Um, what can you do as a patient? Don't delay your first time. That's what I can tell you. If you suspect that you are pregnant, book your first ultrasound scan around 6 weeks. And that is when we can confirm that the pregnancy is inside the womb. Usually, if it's earlier, it may become a little difficult to see if there is a pregnancy in the womb or not. Also, listen to your body. If you have pain, dizziness, or bleeding, don't assume that it's normal. Seek medical care right away. And then have a follow-up. If your doctor asks for repeat scans or blood tests, please do so. Sometimes we need more than one visit to be completely sure what is happening. And also take care of yourself emotionally. An ectopic pregnancy can be emotionally draining. Don't go through it alone. Talk to your doctor, your partner, or your counselor. And remember, having one ectopic pregnancy does not mean that you cannot have a normal pregnancy later. Many women go on to have healthy babies afterwards. So that's what an ectopic pregnancy is, why it happens, what signs to watch out for, and what you can do. The key message is simple: early detection saves lives. Your first trimester scan is more than just a formality. It's a powerful, powerful way to protect both your health and your future. If you found this helpful, please like, share, and subscribe so that more women can understand and stay safe during early pregnancy. Thank you for watching, and I'll see you in the next episode where we will talk about threatened miscarriage and what those early warning signs really mean.